Hi, thank you for joining us for another of our webinar series in a collaborative partnership between the National Consumer Voice for Quality Long-Term Care and the National Long-Term Care Ombudsman Resource Center. My name is Dr. Sherry Gibson, licensed psychologist, and I'm excited to bring to you the last in a four-part webinar series. This webinar is titled Managing Anxiety and Grief in the Time of COVID-19 in service of our direct care workers. The coronavirus crisis has affected us in so many different ways, physically, emotionally, economically, socially, and psychologically. All of us are dealing with the very real challenges of widespread illness and the inabilities of healthcare systems to cope with it. Social and community disruption, economic fallout, financial problems, obstacles and interruptions to so many aspects of our lives. And the list goes on. The COVID-19 pandemic has resulted in enormous loss of life, not only in the United States, but globally. The collateral damage that this level of mortality would exact on American families could never be overlooked. And it's important that the burden of bereavement and its potential mental and health consequences, physical health consequences, is factored into discussions of the public health challenge facing our nation and all nations. Since the outbreak of COVID-19, science has documented that for some people, as a result of social inequities and how their identities are perceived and treated by society, are more impacted than others. COVID-19 has exposed this nation's long-standing social and political inequities in race, class, gender, national origin, and other factors. In recent weeks, we've experienced enormous display of hurt and righteous anger, particularly in the last months by marginalized Black and Brown communities and entire communities across this country who cannot sit back in the wake of the recent killing of George Floyd and so many others before him. So what does all this mean against a backdrop of global pandemic where for the past 6 months, most of our country has been quarantined? Although there has been substantial attention given to identifying persons with coronavirus infection, identifying the mental health and healthcare needs of people impacted by this pandemic have been relatively neglected. This is surprising given the mass tragedies, particularly ones that involve infectious diseases, that often trigger waves of heightened fear and anxiety that are known to cause massive disruptions to the behavior and psychological well-being of many in a population. For example, in a recent large survey of people highly susceptible to the coronavirus, specifically Chinese medical workers, the prevalence rate of traumatic stress was at an alarming 73.4%. Depression was at 50.7%, generalized anxiety at 44.7%, and insomnia at 36.1%. Although those findings are very disturbing, they are not isolated, as research on the psychological impact of previous global disease outbreaks has also demonstrated clear links between pandemic-related anxiety and elevated symptoms of stress, anxiety, contamination concerns, health anxiety, post-traumatic stress, and suicidality. Some interesting research that has come from some surveys conducted by the American Psychological Society found the psychological of a global pandemic has had significant increased levels of stress related to both the economy and work. And what the survey found was a heightened level of stress when compared to a survey previously taken in August of 2019, where 6% of the respondents identified the economy as a source of stress. During the pandemic in May of 2020, that number increased to 70%. And a similar trend was also found with regards to work-related stress. It's important to note here that persons who were surveyed on the work factor were those among those who were employed. Parenting is also very stressful during this pandemic. And parents also during this survey endorsed other sources of stress as a result of the coronavirus pandemic. At the top of the list is the stress related to a family member possibly getting the coronavirus, followed by the government's response to the virus, a disruption in daily routines, fear and anxiety around contracting the disease, and managing the distance and online learning of children who are now at home. Basic needs, self-isolation, access to healthcare services, and missing out on major milestones are all areas of concern and stress among parents. There's also stress that's been documented around the government's response to the coronavirus. And in this survey conducted by American Psychological Society, nearly 7 in 10 Americans, 67%, reported that the government's response to the coronavirus was a significant source of stress in their daily lives. In addition to that stress is just the context of the mass amounts of death and dying that's been a result of this pandemic. The shocking and unanticipated deaths that were consistently seen in the media. I remember the early days of the pandemic and watching the mass refrigerator trucks lined up outside of hospitals and long-term care communities, transporting and taking care of the deceased. Isolation from family, and especially family from their dying loved ones. There's a lot of anxiety around helplessness, a fragmentation of caregiving and important attachment bonds. And also an existential crisis that people are connecting to right now, often wondering where God is in this mass suffering. There's certainly been a loss of religious community as we once knew it, and important rituals that were vital to our coping. A profound loss of meaning and disproportionate loss within minority communities. The pandemic has forced upon us an overwhelming amount of press upon the medical systems that now are void of important family supports. Family members play a key role in care provision. And now those people have been removed from those environments. Important here is to highlight what normal grief is. Grief reactions vary depending on who we are, who we lost, our relationship with that person, and the circumstances surrounding their passing, and how much their loss affects our day-to-day functioning. Different people express grief differently, and you may even have a different grief response between one loss and another loss. Reactions to grief and loss include not just the emotional symptoms, but also behavioral and physical symptoms. And those reactions change over time. All are normal for a short period. So here's some symptoms that are often experienced. Emotionally, people experience shock and denial, numbness, sadness, anxiety, guilt, fear, irritability, and anger. Behaviorally, we see increased bouts of unexpected crying, changes with sleep, loss of appetite, withdrawing from others, restlessness, and trouble making decisions. And physically, grief can take a toll. Problems with concentration and attention, feelings of just pure exhaustion or fatigue, decreased energy, problems with memory, upset stomach, pain, and headaches. Some abnormal symptoms might also include drug use, violence, alcohol abuse, suicidality, and those types of symptoms definitely warrant reaching out to a professional for immediate help. There's also a condition called prolonged grief. Prolonged grief has been identified in the ICD-10 as meeting certain criteria that sets it apart from normal grief reaction. Well, first it involves the death of a close person, and I'll talk about this a little bit later, how grief can also be non-death related. But for prolonged grief, there's a persistent and pervasive grief response that's accompanied by a deep longing for a preoccupation with the deceased, intense emotional pain, all of those feelings and experiences that I mentioned previously. This goes on for a minimum of 6 months following the death. And that does exceed social, cultural, and religious norms, where prolonged mourning might be a part of a tradition or a culture. But most importantly, it's manifested in a significant impairment or dysfunction in a personal, familial, social, occupational, and other functioning. Grieving in isolation is somewhat of an oxymoron, because in many cultures, including our own, mourning is a shared social practice. And we can see that the spike in COVID-19 related prolonged and complicated grief is a potential public health crisis. There's a sense of urgency in the need for timely access to mental health services. This also gives us some opportunity during this time to think creatively about bereavement efforts. We've learned from previous epidemics such as Ebola in Congo about different ways in which we can engage as a community in our mourning, in our grief. Funerals now are being live streamed. It's a new era of what people are calling e-mourning, a new term we're seeing. Physicians and chaplains use now speaker and video chat functions to allow families to say goodbye to a critically ill loved one and to deliver last rites. So where do we go to? How do we cope with this? How do we cope for ourselves, and how do we maybe help others cope during this extraordinary time? Well, I want to share with you next an acronym that's been developed by Dr. Russ Harris, a psychologist and author of The Happiness Trap. Dr. Harris has used tenets from acceptance commitment therapy to put together a very useful tool to help create a pathway for healing and for some relief. And he's used this acronym, FACE COVID. And here's a quick summary of the key steps. FACE, focus on what's in your control, acknowledge your thoughts and feelings, come back to your body, engage in what you're doing. COVID, committed action, opening up, values, identify resources, disinfect and distance. Now I'd like to explore each of these in more depth. It's all too easy for us to get lost in our worrying and ruminating about all sorts of things that are out of our control. What might happen in the future, how this virus might affect you or your loved one, or your community, your country, the world, and what will happen then, and so on. While it's completely natural for us to get lost in our worries, it's also not very useful or helpful. So we want to focus on the here and now. The reality is we all have far more control over our behavior than we do over our thoughts and feelings. So our number one aim is to take control of our behavior right here and right now to respond effectively in a crisis. This involves both dealing with our inner world, that is, all of our difficult thoughts and feelings, and our outer world, and that is all the real problems that we're facing. But how do we do this? Let me give you an analogy. When a big storm blows up, the boats in the harbor drop anchor because if they don't, they'll get swept out to sea. And of course, dropping anchor doesn't make the storm go away because anchors don't control the weather, but it can hold a boat steady in the harbor until the storm passes in its own good time. Similarly, when we're in an ongoing crisis, we're all going to experience emotional storms, unhelpful thoughts spinning around our heads, and painful feelings whirling around our bodies. But if we're swept away in that storm, there's nothing effective we can do. So the first practical step that we have to take is to drop anchor using the ACE formula. Silently and kindly acknowledge whatever is showing up inside of you. Thoughts, feelings, emotions, memories, sensations, urges. Take the stance of a curious scientist during this time, observing what's going on in your inner world. And as you do this, often it's helpful to put it into words. Maybe silently say to yourself things like, I'm noticing anxiety, or here's grief, or there's my mind worrying, or I'm having a feeling of sadness, or I'm having thoughts about getting sick. And while you're continuing to acknowledge your thoughts and feelings, you also want to come back into your body. Now note, by coming back into your body does not mean you're trying to turn away from, escape, avoid, or distract yourself from what's happening in your inner world. The aim here is to remain aware of your thoughts and feelings, continue to acknowledge their important presence, and connect with your body to actively move it. Why is this so important? So that you can gain as much control as possible over your physical actions, even though you can't control your feelings. Remember, F stands for focus on what's in your control. And I've included just some suggestions, some things that have worked for myself and have worked for some of my clients. Things that can bring yourself back into awareness of your body. You might want to sit up straighter, maybe press your fingertips together, stretch out your neck or your back, shrug your shoulders, and breathing. Breathing slowly has a lot of benefits. Paying attention to your breath, getting yourself back into homeostasis. And as you acknowledge your thoughts and feelings and you come back into your body, you also want to engage in what you're doing. Get a sense of where you are in this moment and refocus your attention on the activity that you're doing. Find your own way of doing this or use some of these methods. So looking around the room and just noticing 5 things that you can see. Notice 3 or 4 things that you can hear. And take it a step further and notice 1 or 2 things that you can touch tactily or feel. Just notice what you're doing right now. And then in the exercise, by giving your full attention to the task or activity at hand. Dropping anchor is a very useful skill. The better you anchor yourself in the here and now, the more control you'll have over your actions. So it's useful in handling those difficult emotions and feelings that come up without warning. It helps switch off from autopilot and re-engage in your life in the here and now. It helps by grounding and steadying yourself in difficult situations. It helps disrupt that rumination, or what I like to call just the ongoing tape that's running over and over in your head about the worry. And it refocuses your attention on what you're doing in the here and now. So when you can do this, it makes it easier to do the next steps in COVID. C is for committed action. Committed action means effective action, guided by your own core values, action that you take because you truly believe it's important to you, action that you take even if it brings up difficult emotions, thoughts. Once you've dropped anchor using that ACE formula, you'll have lots of control over your actions. So this makes it easier to do the things that truly matter to you. Now, obviously, that also includes all of the protective measures against COVID, frequent hand washings, physical distancing, and so on. But in addition to those fundamentals of effective action, you might want to consider the following. For example, if you're spending a lot more time at home during quarantine, what are the most effective ways to spend your time? You might repeatedly ask yourself through the course of your day, what can I do right now, no matter how small it may be, that could improve life for myself or others I live with, or with people in my community? And whatever the answer is, do it and engage in it fully. I've included some other questions that you could ask yourself. What kind, caring, supportive deeds can you do? Can you say some kind words to someone in distress? Maybe in person or on a phone call or a text message. Can you help a person with a task or a chore, to cook a meal, hold a hand, play a game with a young child, or play a game with an older adult? Can you comfort and soothe someone who is sick? Opening up means making room for difficult feelings and being kind to yourself. Difficult feelings are guaranteed to keep on showing up as this crisis unfolds. Fear, anxiety, anger, sadness, guilt, all of those feelings, we can't stop them from arising. They're normal reactions, but we can open up and make room for them, acknowledging that they're normal. Allow them to be there, even though they hurt, and treat ourselves kindly. Remember, self-kindness is essential if you want to cope well in a crisis. Ask yourself this: if someone you loved was going through this experience, feeling what you're feeling, if you wanted to be kind and caring towards that person, how would you treat them? How would you behave towards them? What might you say or do? And then try treating yourself the same way. Committed action should also be guided by your core values. Your values might include things like love, respect, honesty, humor, patience, courage, caring, openness, kindness. There's many values to choose from. Look for ways that you can sprinkle these values into your day. Let them guide and motivate your committed action. Because what we know is that when our actions are consistent with our values, we live a much more satisfying life. So you may want to ask yourself these questions. What do you want to stand for in the face of this crisis? What sort of person do you want to be as you go through this? How do you want to treat yourself and others? And what can you say and do that will enable you to look back in years to come and feel proud of your response during this time? Identifying resources for help, assistance, support, and advice is very critical. The National Consumer Voice is an excellent resource. An important aspect of this process involves finding reliable and trustworthy sources of information for updates and guidelines. There's a lot of information out there. So you need to pick the few that you trust and let that be your guide. The World Health Organization is an important one, CMS, and certainly the National Ombudsman Resource Center. Well, we can't say enough about disinfecting your hands on a regular basis and practicing safe physical distance as realistically as possible. Remember that physical distancing does not mean cutting off emotionally. And in fact, there's been some commentary among psychologists who early on during the pandemic made recommendations warning against using the term social distancing. Because when we use that term social distancing, we infer that we withdraw from other people, when in fact we know that really what prevents the disease from spreading is through physical distancing. And we can still be social despite physical distancing, which we're all learning now. So these actions are truly caring in nature. When we take care by distancing and disinfecting, we are living the golden rule. It's a very compassionate response during this crisis. So again, face COVID. Again and again, as these problems pile up in the world around you and the emotional storms rage within you, come back to those steps of face COVID. You might even want to print this slide and tack it up somewhere where you can see it to remind yourself of the things that you can do. Again, focusing on what's in your control. I want to transition now to saying a few words about grief and what do we do with the grief. First, it's really important and normal to express grief and to work through the concerns that arise for you at this time. Avoiding your feelings may not be helpful and may actually delay or prolong your grief if not addressed. So here are some suggestions that may help you and those you serve. Find supportive people to reach out during your grief. This is the time when support of others might be most helpful. Don't be afraid to tell people how they can best help you, even if it means just listening. It is often helpful to talk about your loss with people who will allow you to express your emotions. Take care of your health. Often at a time of loss, we stop doing the things we need for our own health care, such as exercising or eating correctly, taking our prescribed medications. If you're on a healthcare regimen, it's important to follow that plan, making adjustments in the context of limited access and physical distancing. You'll want to postpone any major life changes. Give yourself some time to adjust before making plans to change jobs, move or sell your home, remarry, and so forth. Grief can sometimes cloud our judgment and ability to make decisions. Consider keeping a journal. It's often helpful as a way to work through your feelings or to write or tell a story of your loss and what it means to you. Consider participating in activities, staying active maybe through exercise or enjoyable activities, outings with support of others, starting new hobbies. Those all can get you through these tough times while providing opportunity for constructive development and your use of your energy. You've probably read or heard in the beginning stages of the pandemic, we saw a huge uptick in jigsaw puzzles. In fact, there's one sitting on my kitchen table right now, waiting for me to give it some attention. But there are certain hobbies that have really popped up because of this pandemic. Things that were more social, we're now bringing indoors. Find a way to memorialize either the loved ones you've lost or the loss associated with what we knew as normal. It doesn't have to be death to experience loss. You might want to plant a garden or a tree or dedicate a piece of work or an art piece to the memory of either the person or the intangible thing, the concept. Contributing to a charity can be helpful, or doing other kinds of activities. You might consider joining a grief support group, and remember that depressive symptoms, feeling sad, are a fundamental part of normal bereavement. Staying active and finding support from others can help you work through that process. You can certainly utilize your employee assistance program benefits by getting free counseling, or you can reach out for online support groups that are now happening. There's some virtual grief support groups in most and many communities. Remember that loss is multifaceted, and so is grief. There's no one size fits all. My process will be very different from yours, and so on. You want to give yourself and others the permission to bereave the loss. Hold no expectations for the duration of how it should look and feel. And finally, a word about creativity and resilience. This is an image that was shared by Miss Leslie Carter with Longleaf Assisted Living. And this just demonstrates one example out of hundreds, if not thousands, examples of long-term care communities who are embracing this time to be creative, to allow spaces for people to connect in a safe way, but in a meaningful way, for people to be able to see one another while maintaining safe distance. It's also a time to remember how resilient people are. Looking around us and asking questions about people's resiliency can remind us of hope. Many of the people we serve have lived through lots of challenging times. And we can tap into that resilience by asking them, how did you get through it then? What kinds of words of wisdom do you have for me now? That's an amazing intergenerational conversation that can happen among all of us with the people we're serving. I want to thank you for this very important time we've had together during these 4 webinars. I'm sharing with you here some resources on grief, the Portland Institute for Loss and Transition being a very important one for you to check out. Also some other resources for anxiety. So these are some free apps, COVID Coach, Headspace, the Daily Om. 5 Minutes of Gratitude is a daily gratitude journal that you can do on an app. And then, of course, resources from the Consumer Voice and the National Long-Term Care Ombudsman Resource Center. You can always access these folks through social media, and I encourage you to do that. And I want to again thank you for your time today. Be well and take care of each other.